Dihydropyridines. These are a type of calcium channel blockers. These are antihypertensive drugs. So the actions are it shows minimal action on the heart, that is as a cardiac depressant, and maximum action on blood vessels, causing vasodilation on the blood vessels. As it shows maximum action on blood vessels, it is called peripherally acting drug. Dihydropyridines are the peripherally acting drug because maximum effect on blood vessels. Also, this poses a high risk of causing reflex tachycardia. So, sustained release of the drug should be given. Sublingual route is avoided nowadays. And also, this is given in combination with beta blockers. So, the function of beta blockers is to decrease the heart rate. So, when the dihydropyridines are given along with the beta blockers, there will be the decreased risk of reflex tachycardia. Examples are nifedipine, amlodipine, clinidipine, felodipine, nicardipine, and istradipine. Indication: it is given in the case of hypertension. These are antihypertensive drugs. Causes vasodilation on the blood vessels and also acts as a cardiac depressant. Contraindications: it is not given in terms of angina, myocardial infarctions. But the other two groups of calcium channel blockers can be given in these cases also. We'll talk about it later. But this particular group, dihydropyridines, are not indicated in case of angina or the myocardial infarction. Why? Because they possess high risk of reflex tachycardia. So in case of reflex tachycardia, the load on the heart increases, which is not suitable for angina patients. Right? The adverse drug reactions is first one, reflex tachycardia, and also headaches, flushing, ankle edema, palpitation. In case of hypertensive emergencies, the drug of choice is nicardipine, but it is given along with the beta blockers to avoid the risk of reflex tachycardia. And nifedipine is a short acting dihydropyridine calcium channel blocker, but it is a high risk of reflex tachycardia because of its short acting nature, completely avoided in the patients with angina or the myocardial infarction. Virampin, diltiazem, these are the another type of calcium channel blockers. These are safe for angina patients as it shows maximum action on heart, thereby decreasing the heart rate. So this is the action of nifedipine on the blood vessels, and this is the action of diltiazem and virampazil on blood vessels and heart rate. So this another group of calcium channel blockers decreases the heart rate, thereby it is safe for heart patients with angina and myocardial infarction. But this nifedipine mainly shows its action on the blood vessels, causing the dilation. So in case of this, it poses a high risk of reflex tachycardia, so not indicated in the patients with angina or the myocardial infarction.